Hello, I'm Alan Katz, your host for Louisiana Newsmaker. Thank you so much for joining us. We have a terrific show for you today. Please stay tuned. We'll be right back in just a moment.
What's that?
I don't know. Something I kind of made.
What's it do?
What do I do? Well, thanks for asking. I ring my bell and I like to dance. What do I do? Well, thanks for asking.
Ow!
Yeah, it still needs a little work.
Anything's possible. Keep thinking. Get started on your own inventions or just play some games at inventnow.org.
Welcome back to Louisiana Newsmaker. It's no secret that Louisiana is facing some terrible financial deficits, and many of these involve health care. But we're very fortunate, too, because we've seen one of our legislators emerge as one of the best experts that Louisiana has on Medicare, Medicaid, health services in general. He is Dr. David Heitmeier. He's a West Banker whose state Senate district includes parts of West Jefferson, Algiers, and Plaquemines Parish. And he's a Holy Cross High School graduate. Welcome to Louisiana Newsmaker. How are you?
Thank you, Alan.
Great to see you.
Thank you.
Help us understand this Medicaid monster that our state faces that really imposes a tremendous deficit and a lot of strain on people who may be employed but don't have insurance.
Well, I think if you want to talk about Medicaid first, we have to talk about the FMAP. The way that Medicaid is financed through our state is that it's a combination of state dollars along with federal dollars. Historically, the state would put up $3 and the federal government would put up $7, giving us $10. So it was a 30-70% match. And that's how it works. Since the stimulus dollars, it's now 20-80. But what's taking place is that Louisiana, the calculation is based upon many factors, and personal income is one of them. Because of the dollars received of Louisiana from Katrina, that our income is artificially going up, and so our FMAP is going to go down to about 63%. Well, when you're talking about dollars, it means about $200 million of loss to the state.
And it also means a lot of people are going to get left behind who have real health needs but aren't going to be able to get in to see a free clinic or a doctor.
It means that you're losing $200 million of money that would normally come in, and then those are leverage dollars, so $200 million with the 70% match, so you're talking about significant dollars.
Now, you've come up with a very interesting and innovative intergovernmental transfer that offers Louisiana some hope.
It's a responsible way to look at what can we do. When you understand that it's dollars that are spent from state dollars and then federal match, so what can we do? And doing some research, I looked, and Texas had a model where they utilize intergovernmental transfer, where we correspond that to a parish, can put up dollars which would be utilized as a state match, and then they would enter into a cooperative endeavor agreement with the state to fund health care services in that parish throughout the state. It can mean as much as $250 million to Louisiana without any additional taxes.
How would that work, for example, in the case of Jefferson Parish?
Jefferson Parish would put up, let's say, $3 million. And I've spoken to Jefferson Parish leaders, and they've talked about entering into the cooperative endeavor agreement with the state. So these $3 million that they would put up, they would enter into a cooperative endeavor agreement with the state, and then hopefully get $10 million back.
And how would that go to hospitals like West Jeff or East Jeff or clinics?
It would. It would go to where they determine the dollars need to go to. But West Jeff, West Jeff and East Jeff would be two people at the, or two facilities where it could go to. But there's some other nuances, something called a UPL or upper payment limit, that we can only pay them 100% of costs. So other private hospitals would also be available for dollars, such as Ochsner.
Well, that would be a great thing for them. Everybody wants to get in on that, and it means that they can provide services to more patients.
More patients, and also some of their what's called uncompensated care that's becoming a challenge now with our healthcare system as we're having more and more people with no insurance. The uncompensated care for the hospitals is becoming more of a challenge. A hospital basically has 4 buckets of money if you look at it. One is going to be Medicare, which covers their costs. The second would be private pay, where hospitals make some money from. Medicaid, which is usually below cost, and then uncompensated care that the hospitals eat.
The emergency room, for example.
Emergency room is a challenge. Patients, there's an EMTALA law where if you're sick, you present yourself in the emergency room, you have to be seen.
Which for a lot of people who are indigent or can't get insurance, that's the only alternative.
It is, and for Louisiana, it's a challenge because Louisiana is the 4th worst utilization of emergency rooms in the nation. It costs us to see a patient in the emergency room $465 per visit, whereas in a general doctor's office, it's about $60 to $80. So it's a poor utilization of our resources, but when it's the only one available,
When it's
utilized.
the only alternative, what else are people to do? Is there a way out for us? Is there a way to develop? I go back to the old days of when Charity Hospital was really great in the 1960s, and it really was an alternative for people who needed health care but didn't have a lot of money. Can we get back to that? I don't mean Charity Hospital per se, I mean a new system.
What I think we're looking at is if you look at our delivery system, presently we have an acute care delivery system where patients go when they're sick. I think that our entire delivery system needs to look at how can we change it to a disease management delivery system where we access our healthcare providers earlier, to where we start using primary care
Prevention
dollars.
becomes
Prevention.
the priority.
Primary care and pharmaceuticals, and try to change that from the tertiary and quaternary dollars or the hospital dollars, which are much more expensive, so we can keep patients healthier for a longer period of time.
I would respectfully suggest that's the great challenge for your generation of health givers.
It's going to be a challenge, but it's one that we need to do through education, and it starts early. And that's what our challenge is. That's where we need to go so we can do more with less that government's faced with.
Thank you so much for coming on Louisiana Newsmaker. I'd like you to come back. I'll give you a call next month.
I look forward to it.
That is David Heitmeier. He is a doctor, he is a state senator, and he's one of the brightest people that we send up to Baton Rouge. And there's an upcoming session that begins March 29th. Please stay tuned. We'll be right back.